One of the greatest moments in someone's life is having a baby, and then the supports that you receive during that journey. But oftentimes for young people that are coming out of the child welfare system themselves, or just don't have good family supports, they lack availability to someone that can help them and encourage them and support them during that time.
My guess, because I don't always know what life looks like for them, is that someone who has just aged out of foster care, who may be parenting or pregnant, is that they're feeling pretty lost. They don't have a lot of support from family or professionals because they've just aged out, and so now they have no one who's required to be in their corner.
I really didn't have that many supports around me at that time. I wasn't speaking to my mom. My foster mom I hadn't spoke to in years, so I was like, I'm not going to speak to her. It's nearly impossible to not start from the bottom.
What we've seen through data, what we've seen through lived experiences of the young people that have continued this cycle of working in the child welfare system is just the continued reoccurrence of staying within that cycle, whether it be poverty, abuse, lack of resources, those kinds of obstacles that just don't seem to get any better, but actually get bigger.
When young people face roadblocks in life, they often lead to larger crisis. So, for example, if young people aren't able to pay their rent, that often leads to them facing eviction. So if we can intervene early on and help mitigate that risk, then that will lead to better outcomes for the young people in the long term.
Some of the challenges that we see young people facing in our area are access to safe and affordable housing. We call it the 3 A's: affordability, availability, and age. It can be difficult for a young person to access resources, whether it be time or transportation, availability. The typical business hours that we're so accustomed to are often impossible for a young person to make fit in their schedule. And so what we try to do is reduce those barriers and not only advocating for the young person, but also holding their hand as they access those resources as well.
They were the only people that I knew that would be unconditional with their support, no matter how far I fell, no matter where I was at, and that they would help me through it.
YouTube, there we go. Good afternoon, everyone. Can everyone hear me okay? It's showing muted on my end. Okay, perfect. Good afternoon, Happy New Year, and welcome to CASA LA's Fireside Chat. I am Charity Chandler-Cole, the CEO of CASA LA. At CASA LA, we organize the community to show up in life and in court to advocate for children and families in LA County's overburdened child welfare and juvenile justice systems. Through an intentional, restorative, and culturally responsive lens, we train a village of committed, consistent, and caring adults who provide equitable, life-affirming connections. Our vision is a Los Angeles County in which all children and families have equitable access to the resources and support they need to be whole and thrive. Our mission and vision cannot be accomplished until our children live in a world that is equitable and just. That's why we are committed to doing our part to address racial injustice in the child welfare and juvenile justice systems, and using this platform, our Fireside Chats, to bring communities and various stakeholders together to have real conversations about what's happening in the world of child welfare in LA County, with the hope of building awareness, informing our communities, activating a safe space for all, and strengthening our ability to advocate for our children and families. Today, I have the privilege and honor of introducing you to a phenomenal group of women, all of whom are dedicated to transforming the lives of our youth and families in LA County and beyond. First, we have Amy Dworsky, who is a senior research fellow at Chapman Hall at the University of Chicago, where it is currently, what did you say, 10 degrees below zero?
Above.
Above zero. She is a nationally recognized expert on youth transitioning out of foster care, youth in foster care who are pregnant or parenting, and homelessness among youth and families with a history of child welfare system involvement. Dr. Dworsky led a 4-year implementation evaluation of a pilot project that connected pregnant and parenting youth in foster care with home visiting services. She is currently the co-principal investigator for Activate, a federally funded center that aims to bring sexual and reproductive health research on youth involved with the child welfare or justice system, youth experiencing homelessness, and opportunity youth to youth supporting professionals. We have Jamie Johnson, who is the Director of the Residential Program Services. As Director of Residential Program Services, Jamie oversees the overall program for clients placed in the short-term residential therapeutic program and is responsible for managing the program's compliance with laws and regulations. Jamie began working with St. Anne's as Assistant Director of STRTP Clinical Services. Prior to coming to St. Anne's, Jamie was a primary therapist at the Occupational Therapy Training Program. In 2016, she supervised and trained clinical staff at Pinnacle Family Services. She received her master's in clinical mental health counseling with a certificate in marriage and family therapy from North Carolina A&T State University in 2010. We also have Maria Mejia, and I'm not sure if she's joined us yet, but if not, she will shortly, who is a public health nurse supervisor and has been a nurse for over 30 years. Maria's nursing background is in surgical intensive care and labor and delivery. She's been working with the LA County Department of Public Health for the last 17 years. Maria's current assignment is as an acting nurse manager for the Nurse Family Partnership Program. Nurse Family Partnership Programs provides in-home visits to first-time pregnant and parenting mothers in Los Angeles County. Through this work, Maria is able to provide personalized case management, support screenings, and referrals to community resources. And last, but most certainly not least, we have our very own Laurie Halderman, who is the program manager for our early childhood program here at CASA LA. Laurie's work includes both early childhood and expectant and parenting youth. Laurie has continued to work for CASA for over 20 years in the advocacy department, with a break of 6 years where she utilized her early childhood knowledge and practiced her advocacy skills with her own children. Laurie earned an MS in counseling at California State University, Long Beach, and has completed the Early Childhood Fellowship Program sponsored by the UCLA Department of Mental Health in 2021. So congratulations again for that, Laurie. So thank you all so much for taking the time out of your busy schedules to join us, and welcome again to our fireside chat. For our audience, we will take a few questions towards the end if time permits. So please go ahead and submit any questions you have in the Q&A and we'll be sure to get to them. So team, let's get into it. There's recently been more of a substantial focus on key outcomes as they pertain to education, employment, housing, and incarceration for youth that are in or exiting the foster care system. And until recently, there's been less of an emphasis on how early parenthood can affect the trajectories of young people who have had a history of system involvement. Given that this is a vulnerable group, which often lacks essential services and support and faces unique challenges that make their journey more difficult than young parents who have a family support system, I wanted to start this year off focusing on our expecting and parenting youth in the foster care system. As someone who was a teen mom who exited the foster care system, homeless and pregnant, this topic is very, very important to me. And I've been able to have a unique lens through my experience and through the experience of a lot of other young mothers that I've seen either get support or not have support. But I wanted to bring in some of the experts, the people who have been in the trenches day in and day out and really working with this population, and just get your take on first, who are, in your words and in the work that you do, who are the expecting and parenting youth that you work with? And anyone can start off and really defining what this group is to those who may not be aware. And Amy, I see you're on mic, so let's go ahead and start with you.
Okay, well, what I'll say is I these days I don't work directly with young people who are expectant in parenting. I'm doing research these days, but I did actually start my social work career working with expectant and parenting youth in Syracuse, New York for a number of years. So I do have some direct practice experience. What I know from my research, however, is that as you kind of alluded to, a large percentage of the young people in foster care become parents at an early age, much higher than the percentage in sort of the general adolescent population. So we know from a couple of longitudinal studies, for example, that about half of the young women in foster care become pregnant at least once by age 19, which is much higher than you would find sort of in the general population of young people. And probably about a third of them are parenting. So that's a really high percentage, and it really indicates a need for the child welfare system to pay attention to their circumstances as well as to the circumstances of their children to make sure their unique needs are being met.
Thank you, Amy. Jamie, what about you?
Yes, I'm just going to piggyback a little bit off of what it's Dr. Dorsky, right?
Yeah, but just call me Amy.
On that name.
You worked for that. But what I will say is, coming from St. Anne's, our residents that we have are between the ages of 13 and 18. They have to be out just before their 19th birthday. And majority of what we see from the EPY group is children that have been victims of trauma, victims of abuse. They've been in the foster care system, of course, because we see them, but they are just victims of just generational traumas that have been passed down from their families. And they've been, a lot of the time, minorities. So a lot of African American, a lot of Hispanic. There is a lot of that even are new to just the United States in general, is what we see, that don't speak any English. So it's a lot of children that just have not had maybe the needed guidance that they should have gotten, throughout their years that they were with family or whoever they were with, that end up kind of falling and looking for support in other areas and become pregnant. And what we're seeing in our facility is not just pregnancy one time. It could be 2 to 3 times. And with the more children that they have, the less resources that are available. So that's a lot of what we work with and a lot of what we see in our facility and even aftercare.
Thank you, Jamie. Laurie, what about you?
I would build on what both our doctors have said, because I see that Dr. Johnson and Dr. Dworsky. I'd also point out that our youth are also at that adolescent stage. So their brains are still growing and developing, and that brain doesn't close until 25 to 27. So they're having some unique challenges that are going on at that developmental stage while trying to be a parent, when many times maybe they haven't had that role modeling on how to be an engaged and effective parent. Then you add the overlay of poverty and the overlay of trauma, and they're trying to parent and not have their child go into the system and have the cycle repeated. So there really are some unique needs, but I think some wonderful, unique opportunities. And a challenge that LA is having right now is that many parenting youth who are non-minor dependents stayed in and had additional support after their 21st birthday. And then a cliff happened on December 31st, January 1st of this year, where that funding ended and those resources ended. So we now have a population of parents with young children who just lost a bunch of resources as well. But I have seen some wonderful opportunities where a village does get created, but it takes additional work and effort to do that in partnership with the youth instead of taking over.
Thank you, Laurie. And that's so true. And one of the things you all highlighted in your responses was the unique needs of expecting and parenting youth. And I want to kind of get into that based off of your experiences, because we do understand and know that there are, a set of challenges that all young people experience if they, are expecting or parenting at a young age. But the barriers and the circumstances just happen to be more unique if you're in the foster care system and you're not wrapped with the support and love of your family or people that are being very intentional about, Laura, you mentioned your development, your brain development, how you even perceive the world, how you come to even think and exist as a parent, and how you parent your child because of lack of parenting you've experienced. So can you all maybe just touch on, in your experience and your personal beliefs or assumptions or just what you've seen, what are some of those unique needs, and maybe focus on the ones we all hear about and know about and the ones that kind of get overlooked. And as a result, we are underserving this population of young people because of it.
I can start off with this one. The unique need that I typically see is that we're still, aside from the program participants that we have in this group, there's also the barrier of actually getting them to trust and buy in to what's being offered, that I feel like makes it very unique. This is obviously a child that is in or child or adult at this point that is has experienced significant traumas before they even get to us. So they're not in the home with their parent any longer. So now there's this group of people that come into their lives that they already don't have maybe the social skills to be able to trust other people. Then you have a bunch of random people coming in trying to offer support, and they don't feel like the support is really stable anyway. So when you're already starting off from that place, and then you're trying to get somebody to buy in, there's a lot of pushback. So it's a lot of time, a lot of patience, a lot of breaking barriers with this group in order for them to even buy in and want to take what you have to offer. Like sometimes you really just want to be like, hey, I'm really trying to help you sit and listen because I have what you need. But ultimately they have to really, their voice and choice, you really have to listen to exactly to what they're asking you and try to meet them where they're at and try to slide some gifts in between time. Like, yeah, that's great, but maybe we should also do this too, so that we can get, birth certificates in place and build up this, get you to go to school so that you can have these other benefits that can come later. It's really like this balance that you have to get with this group.
When you said trust, I don't want to lose that thought, because you made me think of something. And it's not only, I think, the trust you mentioned, which is so important, is something we don't actually talk about, but also when we consider the way in which some children are removed, and when they're experiencing being removed from their parents, and how traumatic that experience could have been, especially, and we know the statistics, I say it all the time, 80% of children are removed because of neglect that stems from poverty and not actual abuse. And so when they experience that trauma of, people come into their home, taking them either forcefully or not forcefully, and then now them having a child and thinking to themselves, wow, I'm not going to let this happen. I know for me, that was my experience. I'm not letting y'all get anywhere near my child. Back up. It's not happening. I didn't even want to give birth because I was so afraid of someone, coming in and taking my child. So wondering how, that plays in their, very fragile minds of, if I give a little, how will that be used against me in the future, being that I've had this traumatic experience of being removed from my parents. So I just wanted to throw that out there, because I don't think we talk about that at all. So Amy.
Yeah, I'll talk about two needs. The first one builds a little bit on what Jamie was saying and what you were saying about trust. So one is childcare. If these young parents are to go to school, to finish their education, or to get a job, they're going to need childcare. But one thing I've heard from some of the young parents that I've talked to over the years is that they just don't trust sort of formal childcare centers or childcare providers. They feel much more comfortable with like a family member or friend, but then they run into a problem, because if they rely on those sort of more informal sources of childcare, they're often not eligible for any childcare assistance. So they're sort of caught, their preference for informal care, but they need to pay for it. So they're being, moved towards the formal care, which they don't really trust those providers. So I think that's one need. And the other I'll mention is housing. So I think I don't know as much about the situation in LA, but I know in other places in the country, it's very hard to find foster homes willing to take, say, a mom and a baby. Yeah. So the other option for these young people is often to get their own apartments, yet they're not necessarily equipped to be out living on their own at this young age and caring for an infant, for example. So I think there's a real need for better placement options for this group of young people.
You hit it on the nail, Amy. And I want to quickly welcome Maria. Maria, we already gave you a glowing introduction, and right now we're talking about some of the unique challenges and needs of expecting and parenting youth. But Amy, I do want to also talk about, I spoke with someone recently who's a young person who's parenting, and when you brought up childcare, not only is there disconnect when it comes to trust with childcare, with the childcare center, but also the limitations and barriers around childcare. A lot of the jobs, as we move into this virtual space, or we move into everything being, online, from being able to purchase from these big, box businesses such as Amazon. Amazon hires a lot of young people, unfortunately, as do a lot of other companies, and a lot of the jobs are during times where childcare is not available. And so they have to work night shifts. So they're limited to working, between, 6 a.m. to 6 p.m. And so when they are able to get a job, they do not have childcare that's 24 hours, and or depending on where they're getting their support from, it also doesn't cover anything overnight. And God forbid, being 18 and wanting to come home in the middle of the night to pick up your child somewhere that's not close to your home is also a huge barrier. So, really looking at, as people who provide services and deliver programs, how do we really meet these young people where they are, so they're not boxed into, they're not put into this box that we know they can't, really thrive in. So thank you so much for bringing that up, Amy. Laurie, I think you were about to
I
say
want to focus on even before the baby's arrival, some
Mm.
of the unique challenges they have. As Jamie brought up, is meeting the trust and building that relationship with our expectant parents, but we need to give them the skills and tools to advocate for themselves during their pregnancy, so that what's going on with their body or what's going on with their emotions, that the providers hear them, that the doctors listen to them, or the nurses listen. There's been lots of feedback that culturally a lot of doctors are not listening to their patients. And we know that if they're stressed, the maternal stress will impact the baby as well. We do not do a good job training our youth on helping them role model and practice the skills they need to speak up, or to make the phone calls to the doctor's office, or get the prenatal vitamins, or create a budget with the monies that are now coming down, the $2,700 in the expectant youth payment that's coming down. That's a huge chunk of money, but you have to have the knowledge on how to track and budget that. And when you haven't had access to that, and you're a teenager, not just an expectant youth, but just a teenager, it's kind of fun to go spend all that. But if it's not spent where you need it, that adds additional stress. So that's a unique need that our kids have. As a 30-year-old, I can go and call the doctor and advocate when something's wrong. They're going to listen to me. Are they going to listen to an 18-year-old saying, this is happening to me? Probably not, unless they have the skills to communicate that.
Thank you, Laurie.
Very well said, Laurie. Thank you for having me here today, for all of you. Laurie, what you just talked about is what our program goals are, the three: healthy pregnancies, healthy child health and development. But what works for CASA would be our nurses are equipped to teach and self-efficacy, and how to advocate with providers, how to allocate resources, and how to budget, how to everything. That's what our nurses do. Our nurses visit them from as early as pregnancy up until the child reaches the age of 2. Through that trajectory, there is a nurse that visits them on a weekly basis initially to develop that trust relationship with that nurse. And then bi-weekly, soon after the month is completed, the nurse will see this client via, right now because of the pandemic, through phone, but it's an in-home visitation program for pregnant mothers. Those are the criteria. We have other home visitation programs to meet the needs of other clients that may not fall into the category of first-time pregnancy. If you come across any patients that may need the support from our nurse family partnership, or parents as teachers, or what is our other Healthy Families America, you are more than welcome. I'll send you all the referral to complete, and you can get soon started to have a nurse to start seeing some of those clients that fall under the category of that you are seeing, that can benefit from the support and education throughout for this 3-year period of participating in home visitation. It is voluntary though.
Yeah. It is. And that's I love Nurse Family Partnership. I love Healthy Families of America and Pat. I've experienced that as well. The challenge though is some of our youth have given feedback that if their priority is different, let's say in meeting the nurse, they're trying to find a place to sleep that night, or they have finals, that they're going to put that, let's say they're in school, they're going to put that priority. So it's a wonderful program, but how do we bring the youth along to see that it's benefit? Or how do we adjust the programs to meet the youth needs instead of the youth adapting to meet program needs, if that
was
makes
one
sense?
of the, that was one of the big findings from our evaluation of the home visiting program in Illinois. So we had a pilot program, which is now a permanent program, which provided home visiting to pregnant, parenting youth in care. And one of the things we learned from that pilot was the importance of the program being flexible. And just as you said, meeting the young people where they were at. So in some cases that meant not doing weekly or biweekly visits. Sometimes it meant, visiting the young people not in their home, but somewhere out in the community, or visiting them at their, the father of the baby's house or wherever they were at that point. Or just knowing that these young people sometimes disappear for a period of time and then pop back up. So that was just one of the really important things that we learned was, the home visiting programs having to learn to adapt, as you said, to better meet these young people where they were. The other thing I'll quickly mention about the evaluation, one of the other things we learned was that one thing that the young parents really appreciated was that their home visitors were not part of the child welfare system. And so they felt they could talk to them about issues that they would never raise with like their caseworker. And so it was really someone that they felt they could get the kind of support that they needed and weren't just not getting from other places.
I personally love that.
I think there is a lot. Of information with the two last comments that were just made by both you, Amy and Laurie. As far as we are Nurse Family Partnership. We do have a model, that we do follow, and we definitely try to be as flexible as we can. I've worked for the Nurse Family Partnership for 17 years. We're very flexible as far as we give them 90 days where they go AWOL. We will still give them the opportunity to still participate in the program. We're definitely very flexible, but I think that the way the model was designed based on theory-based, format model requirements is because the youth that come from the backgrounds, we try to teach them, the consistency, the pattern, the routines, now they're new parents. We're trying to break cycles that were there before. So all the pieces to the model, there's a reason for that. But still, for our nurses, it's really important recognizing that the backgrounds that these, foster youth come from is not the ideal, and it's going to be stressful and it's going to be different. And so we do try to meet them, in those areas so that we are able to, improve for those that are parenting new children, and teach the importance of meeting and being consistent and providing a routine and a pattern. So we strive definitely to meet them where they're at. Sometimes, again, if we do have some guidelines, if they're not able to meet us in a 3-month period, so we want to open it to another person who may be, in obvious needs. In reference to like the resources, well, we all know we have housing issues all throughout in the nation right now. I'm telling you, I just got off a call with the nurses are attending to the PEH call center, which is people experiencing homelessness that are COVID positive and they don't have any means to isolate and quarantine. We have over 400 cases that are calling into our center, and we have 50 beds available. So you can imagine what that's going to look like. So it calls for a lot of education, saying how can you quarantine or self-isolate in your own home right now, because chances are that you may not be able to get a place based on our criteria for placement. So it's very challenging to meet them sometimes, but we do teach and self-efficacy. How do you advocate for yourself with the Department of Social DPSS? If you're a CalWorks client, what resources do you have available to you? Ask your game worker, let's have a conversation. So that's what we definitely do, strive to meet the patient where they're at, or the parenting youth where they're at. But it's definitely very challenging, but successes definitely are are, annotated and they are there. And so we definitely are doing the best we can with providing the services that, that best fit our clients.
Thank you, Maria. And I'm wondering how much opportunity exists, because I'm to not be so by the book, and follow, strict requirements and guidelines. And I say that coming from a place of, and I mentioned earlier before you were on, Maria, I was a teen mom coming out of the foster care system, homeless. And I look at two situations where me and all my sisters, actually, all four of us were teen moms, 3 of us coming out of the foster care system. And one of my sisters in particular, who's actually a social worker with DCFS now,
Jessica,
yeah. So I was like, girl, you need to be on this panel, but she just had a baby, so she gets paid. But we had, very similar experiences where we had, babies right out of the foster care system. And depending on which group home we came out of or where we were situated, what type of support we had, she received so much help, so much support. She, I believe, had, a nurse through the family health partnership, the nurse family partnership, and she loved it. And I would be visiting her house and I would see nurses come in and showing her how to breastfeed, showing her how to hold the baby's head, giving her diapers and support. And I'm just sitting there like, let me take some notes, because no one, came to my rescue and helped me and showed me anything. And so it really depended on, where we were located, because that service was not offered to all of us. And I have to ask why, because we are 2 sisters who came from the exact same home, had the exact same set of circumstances, exact same experiences, but where she got support and I didn't, it also was kind of meant to be, because I wasn't as receiving of some of the support and services as she was. So if I would have had a nurse come in that was totally different, I probably would have taken the support, because that's a different type of support. But when it came to, the transitional housing, the laundry list of requirements, the programming and everything, I remember having to leave my transitional housing because I was so limited in what I could do, how I could be successful, what they thought I was able to achieve because of this background I have, and because of even the stigma behind, how society perceives, foster youth in general. But if you add that layer of now she's pregnant or parenting, we were, and this might have changed because I'm a little tiny bit older since having my child 16 years ago, where we were perceived, at least I was perceived as inadequate, as if I couldn't achieve great feats and things. I couldn't go on to college, maybe look at a trade school, or maybe try to do this with your life, or really box me into the point where I had to break free because I was so limited. And because there's this one size fits all solution at the time. I know a lot has changed since then.
Yes.
That was applied to how I was able to show up. And so now, when Laurie and everyone else was talking about, meeting our young people where they are, giving them options, allowing for that flexibility, prioritizing their needs and their wants, even their dreams, y'all, over this checkbox we created, I think is so important. In the financial, Laurie, you touched on the financial component. For me, that's what did it for me, because even though I had this bold desire to prove the system and everyone wrong, I was that 18-year-old who was homeless and poor, and for some reason, every credit card company knew to send me that little $100, $300 credit card, and I'm broke on welfare. I'm like, I took all of them, maxed them all out, never paid them back, not knowing that, oh, there's this thing called credit, and it's going to screw me over later in life when I'm looking for an apartment. Like, wow. So even when we talk about, talking about not just financial literacy, but helping young people understand credit, how to manage their finances when we do give them funding, it's so important, because if we want them to have self-efficacy and self-sufficiency when they are able to leave and transition, we don't want them to be another charity like, oh, I have a 300 credit score and I can't get an apartment, and I can't get a job, depending on where you're applying to. So there's just so many things that we have the opportunity to really teach our kids now that, we can apply a one size fits all solution, because we're not all the same depending on where we come from. We're not. And I want to kind of pivot this because we have some really good questions in the chat that actually align with my next question. Karina, did you see my question list? Because you're asking all the questions on my list. So I love that the audience is right on track with what we're thinking. And Amy, maybe you could start with this because it's really tied to the work that you do. How do you think the access to reproductive health education and contraceptives impact the rate of pregnancy for youth involved in the foster care system? And let's even tie into, as the rest of you respond, how knowledgeable young people are over, the rights they have with their reproductive health, how to prevent pregnancies, how to manage pregnancies, how to, support their pregnancy in a healthy way. So if we can just kind of touch on that
Yeah.
for our young
So
people.
I think this is a really great question. So I think what happens to these young people sometimes is that no one takes responsibility for this. So the caseworker says it's the foster parent's responsibility to talk to the young person about sex. The foster parent says, oh no, I'm not talking about that because I don't want to get in trouble. So it's the caseworker's responsibility. Or, oh, the young person's going to get it in school, except that the young person was changing school so much because her placement was changing that she never got that curriculum. So I think part of the thing is that it's sort of everyone else is thinking someone else is doing this and no one's doing it. So I think that's one big problem that needs to be addressed. There needs to be, I would suggest that we have better training for foster parents and caseworkers so that they all are taking the time to talk with young people about healthy sexual development and reproduction, and so that young people feel comfortable talking with these adults in their lives about these issues if they have questions, and someone's telling them where to go to get sexual and reproductive health care services. So I think that this is just, there just needs to be better policies in place so that everyone knows what their responsibility is, so that young people do not fall through the cracks, which I think happens all too often.
I think normalizing sex in general, I think would kind of piggybacking off of what you said, Amy, I think all the way throughout, like in our facility, we're required to have sexual and reproductive rights all over, the facility so the residents can see them. But overall, I think the girls that we see in our facility, they talk about sex all the time. And we're always like, oh my God, they use the word sex, or oh my God, they use the word boobies, or anything like that. I think just normalizing that sex is something that all of us, have taken part in one way or another, and just being more open to the conversations, no matter how it sounds, no matter what thoughts come out. There's just I'm coming from an STRTP group home perspective of just seeing the conversations that happen in general as they're sitting in a circle, having their, TikTok conversations and whatever else, just the RCs really sitting with them and speaking with them. It comes up all the time. It's just a matter of us getting in when they're open to it and not saying, okay, we're now going to have a meeting and we're going to talk about sex. Here's some condoms and here's some contraceptive. I think it should be more so of a conversation of, they're already having it anyway. Let's jump into the conversation and add in some of what we already know, and also just doing away with the things that just are not very true. There's no proof that it's true, or you're going to get pregnant this way or not this way, just dispelling the myths. So I totally agree with you, Amy. I think we just need to normalize just the conversation and everything around sex.
Well, and there has been legislation that has come through that the social workers are required to have these conversations and document them in their court reports. Now, what's required and what's happening, mixed. But I thank you, Mara, for posting in the chat box the website where that information is. But I think as you say, it's important to normalize the conversation and have those conversations so that accurate information is shared. They have a place they can go and ask those questions. And we need to make sure they're getting that opportunity to get that. And because kids move, whether they're in an STRTP or they're moving resource home to grandma's home, to a great uncle's home, to a family friend, that they have that information, they know where to go. And it's our responsibility to make sure that they have it, and asking the court to bring it up and making sure that it is in the report and that's happening. And if not, make sure it happens. So to have the formal training, but also create those informal opportunities that you're talking about. I know the Nurse Family Partnership nurses are having those conversations in a wonderful way. We just need to make sure it gets expanded out, and they know where to go.
I want to piggyback a little bit on what you said too, Laurie. I think the other piece of it too is the shame that I think we might accidentally put on the thought or sex. There's sometimes girls have come back with like hickeys on their neck, and we have side conversations about, oh my gosh, she came back with hickey on her neck. What did she do while she was out? Instead of me, because I'm more direct in my response and with my relationships with the residents that I have, what is that on your neck? What happened? Were you safe? Because I mean, it happened. You're not trying to cover it up. I see it. You know that I see it. You see me that I see that there's something, on your neck. Let's go ahead and have a conversation about it instead of having the sidebar and us coming up with this whole plan. And maybe she did, maybe she didn't have sex, but maybe just asking and showing some care about what you saw and that we actually noticed what was happening may lead to a more honest conversation without the shame that might come with it.
And I'd bring that up on the boys' side too.
Yeah.
Or however the youth identifies, that the conversation is happening for all our youth.
Yep. I was going to bring up shame, Jamie, but you take it somewhere else, which is so important too, even before, being expecting or parenting. But there's a lot of shame and judgment that these young women and men experience because they are pregnant or having children, and thinking about how that plays into, their desire to even go to the doctors because of how they feel they might be perceived, or ask for help or ask for support, because there's a lot of shame associated with having children at a young age, especially in our society. And I want to kind of plug that into, how do you feel these young mothers and fathers experience, health equity when it comes to showing up, in support of their expecting child, or even getting support for the children they already have. Are you seeing that there's disproportionality? We already know there's disproportionality in the child welfare system already, where Black youth and Indigenous youth and brown youth, or especially Black and Native, are overrepresented in the child welfare system. Do you see any correlation to that? And I'm not sure if there's a lot of data on this, because I've been looking a little bit, and I think this is a great opportunity, wink, wink, Dr. Dorsky, for us to do some research, around that, because, what is the disproportionality as it pertains to this group, and then why are we seeing so many more Black and brown young women and men experiencing pregnancies? And is that tied to the shame, the stigma, how they're served in general in the child welfare system, and the support they receive, not just in the child welfare system, but in our healthcare system and then our educational system? There's a question actually about education that we're going to get to in the Q&A, but what have your experiences been? And then Dr. Dorsky, do you see a gap in the literature and the research that we can, start to look at and really examine that?
I'll say I know most about the situation here in Illinois, and I will say the vast majority of young people in care who are parenting are African American. At the same time, though, that also reflects the fact that a large majority of the young people in care are African American. So it kind of mirrors the population here in Illinois of who's in foster care. With respect to the equity question, where I see that coming up a lot is more of a geographic equity issue. I think in many states, there are a lot of services available for this population in major urban centers. But once you get outside those major urban centers, there's very little available. So young people who are in small towns or rural areas and are pregnant or expecting, there's very little in terms of resources available for them. I know that's a struggle here in Illinois, and I've heard about it in other states. So I think that's a sort of a different equity lens that we have to think about is geographic availability of services for this population.
Thank you for that, Dr. Dorsky.
I think another piece to just to piggyback a little bit more about just the people that we're seeing as far as African American and Hispanic, who, at least in our population, I think it might be a little bit more Hispanic in ours. I think the culture piece is really, really big. For my research and my dissertation, I did a lot of work with just the African American family and what makes up the African American family. And a lot of times there's a religious standpoint that comes with it, and what the church says and what the church feels. And when you engage in having sex and not being married, what that means, which again, I'll bring up the shame piece. So it's very shameful to, of course, be having a baby at 13, 14, 15, 16, 17, 18 and not being wed. So it's a lot of things that are being hidden and shamed in just expressing what you're doing outside of those church walls, even if you're going to church or not going to church, or whatever spiritual or religion you assign yourself to. It's just that shame that goes behind it. From the other standpoint, as far as just the Hispanic community, it's, I think building on your family, the machismo piece and that kind of piece falls a lot into the having sex at the age that you're having it. And maybe you came from a family that was really big and you had your cousins, with you, you had aunts, uncles that were really, really close, and you guys may have all been in the same household. So just maybe reliving and having that same community that you had before, it just kind of expresses itself that way when you're, by yourself and you're trying to repeat that same pattern as well.
Yeah, absolutely. Maria, I think you're talking, but you're mute. Were you? Okay.
So I'm hearing this conversation and it sounds like there's so many, obviously there's so many variables here to consider in terms of how to, make all this information more accessible to either where we're talking about prevention, pregnancy, or once they're already pregnant, and maybe finding a way to provide some type of service to these clients. I just wanted to share from the standpoint of home visiting programs under Department of Public Health, and I know also with other private organizations and other places where we can, provide services to provide the education, whether it's, at a level like Charity was talking about how, her sister had a nurse and, maybe the resources was not available to her. And maybe I do want to say that we are definitely growing in terms of like the home visiting programs. There is a lot of resources out there. It's just we have to be able to, get out the information that, for those that are already pregnant, at least for that part, we can break those cycles by providing the education through our home visiting parenting experts, whether it's an expert, because I look at Charity and she didn't have a nurse, but I see the amazing person that she's become, through her experience and advocating for the parenting youth. And we can continue those efforts by making sure that all the resources and all the parenting, mothers, whether they're pregnant or after pregnancy, we have a variation of home visitation programs that they can have someone. It may not be a nurse, it may be a parenting expert, it may be a social worker, but we all definitely need to be providing those conversations, and we can do it through our home visiting program. So again, I'm going to remind, I will send referral forms that would need to be completed. And in DPH, we have all models, the HFA, the PAT, and the NFP models available, and we will find a place for your parenting youth to get the support that they need, so that we can help at least. It may not be immediate, but we can start breaking these cycles by providing them someone who can support them along, the trajectory of being a new parent.
And you say something, Maria, that you use the word cycle a lot, and I appreciate that, because one of the things I'm really driven to focus on right now is preventing the generational cycle of system involvement. I think I saw data somewhere recently where it said upwards of, I think, 53% of system impacted young people, children, enter the system. And I take great issue with being in a system where we remove children under the guise of child protection and child welfare, and then we're not doing our part to ensure that they're receiving what they need so that they can be this good, ideal parent that we've created, that we need them to be, so that their children don't get removed. And we have education, we have resources, but getting it to them, has been a challenge. And so, how do we, one, make sure what's needed? Let's just start there, realizing that the system can't do it all alone, and that we have a village, we have a community, we have people that have been in the trenches day in and day out that will show up for their community, show up for them. But there's even limitations around how we can show up, how we can support, or if we're not providing the service and someone is, or if someone's even supplementing it, that can be an issue. And so what's really needed to make sure that we as a village, we as even the system, which I'll remind everyone here, the system is a collection of people that show up to a day and get to decide how they're going to show up and what they're going to do with that title and role they have. And so how do we be intentional? Also understanding all the complications that come with getting a teenager to do anything. I'm not going to ignore that at all. But how do we make sure that we don't have situations where we have two girls who are parents, like my and my sister, where one don't get the information, what's needed, because we can send out the referrals, but what's actually needed, just from your perspective, what's not working, what are some barriers, what's some of the resistance for even seeing that you would like to see for you and the work you do to really help move this along?
I think that what we've learned through this pandemic, and here I am in a meeting with you guys, right, in teens, which I definitely was not expecting to be part of. And yesterday I was in another meeting with my boss said, you need to go to this chlamydia gonorrhea dashboard with Mario Garcia, and they're going to talk about how to, get the information out there with the for the expedited therapy for partner treatment. And I'm thinking, okay, well, what can I do there? But when I was there, I wanted to say, wow, like we have nurses that can provide this information. We have staff that can get this information. What is needed is to have these conversations. And we've learned anything through the pandemic is teams, right? Like I'm here with you and we're all going to get a referral, and we all know that this resource is available and we can complete that referral and send it. Because I'll tell you what, you said, I think, the flexibility in meeting the parenting youth. We definitely have this model that we follow, and all our funding comes through data, through outcomes, to measuring of outcomes. And unfortunately, they always look at the numbers, and right now our numbers are really low. All the home visiting programs, we get all this money and all this funding, and our numbers are really low because there's not enough people that know about all the existence of these home visiting programs, so they don't refer, or for whatever reason that information is like. But I think more meetings like this and inviting people to have these conversations and getting those referrals so that they can come and we can refer them and we can see them. I think more meetings and more collaboration is what we need. I mean, who said I'm looking at CASA? Well, okay, let me see what I can do there. But here I am, and here we're having this conversation about topics that are really important and affect all of us. So in answering your question, we need to be able to participate. And as much as I complain, and I know you all do too, because we have one meeting after one meeting and we don't even get lunch because we have to participate in all these meetings. Right. But that's the positive side of the pandemic. I mean, that we now have Teams, platforms to see each other. So instead of driving somewhere, we can see each other and we can share information and provide the resource to the people that actually need it. I mean, there's definitely a lot of things that need to improve. Like all these programs should not be data driven. We should not be looking at, okay, well, how many visits does this nurse have? Or how many cases does she have? Politics, we're all involved in trying to meet the numbers, but in its quality, it's quantity versus quality of a visit. And I think that's my biggest complaint from all my nurses is, why are you looking at my nurses? Can you look at the successes that I've had? This client is no longer in this situation. This client has a job. It is strength-based. It is, we focus on what is your strength? What do you want to do? What kind of a mom do you want to be? A person who wants to go after, getting a nursing license? Do you want to be just a stay-home mom? We have the skilled staff that, can look at all those things and make an assessment and support that person where they're at. So I think, more conversations like this need to happen, where we're looking at the different variations, but the different, things that clients, and meet them where they're at as far as what does she want to do. So
can I build on something Maria said is the youth need to be at the table. So when we're having these conversations, our youth need to be at the table so that we learn from them what helps them for us to better help them. So it's kind of like driving a car where they need to be driving the car safely, hopefully, but that we're alongside giving some directions, but they're still choosing to drive. I do want to build on one way that our youth can find this, and this is out for our wonderful DCFS Alliance and Public Council. They facilitate these expectant parenting youth conferences, which are wonderful and amazing opportunity to share what's out there and what's available with the youth, whether it's a birthing parent or a non-birthing parent who are in our system, and try to connect with them and make it strength-based. So that's one way of bringing the youth along. But I think when we have these conversations, we need to have youth at the table. Because it's for and about them. And if they're not guiding it, it may or may not work without them being at the table.
And I love, Maria, that you said you ask them questions. You ask them what they want to do with their lives. And that's something, giving them agency is so important. So thank you so much for saying that. Amy, sorry.
Yeah, I just want to say, I think in Illinois right now, what they're doing is routinely asking every young person after they've given birth or fathered a child if they want a referral to home visiting services. And they explain what home visiting is about, and then make the connection if the young person is interested.
Thank you. And thank you, Jamie, for answering the question, some of the questions in the queue, but I do want to take our last minute to answer, and one person can answer this question, or if we have time, more than one. What is your view on how to engage fathers in care during their partner's pregnancy and in parenting? Are conversations happening in specific, and are there specific resources for them? And I appreciate this question so much, because oftentimes fathers are overlooked and also underserved. So would anyone like to take that answer?
I will. Go ahead, Jamie. I'll go after you.
Okay, I was actually just typing my answer to that question. So what I can say is what we've done in our facility, we've kind of teamed up, because it just so happens, especially recently, there's been a lot of court orders for father of babies to have visitation, whether, and actually I've seen it both ways, where the youth is in the relationship with the father of baby, and when it's not. And when they're not in a relationship, and this person, this father just wants the rights to be able to visit their baby and to be there. So the courts have actually put it to where we are required to do it. So as a facility, we have been required to either assist with taking the child to wherever the father is, or taking the youth and the baby to wherever they are, whatever they're going to meet to have this visitation. Even before the baby is there, we've had to have visits where, father, baby, and the resident are together at the same time. And that's just something that we're doing across facilities, back and forth. I'm not sure how that works and what's there that's present outside of, honestly, the court order. What I think should be happening is that I think there's this belief, and I think this is even outside of the youth or transitional age youth that are in this age frame, is where males don't feel like they could have the right even if they try.
We could do a whole panel on why historically that is. Maybe that'll be our next one. Maybe we'll do one on fathers and how.
I think that would be a great topic, honestly. But I think there's this internal belief that, there are no rights that they could possibly get, so they don't try to. And I think because there's so much focus on what needs to be happening with the youth that's actually delivering, there's not so much concentration on the father's needs, or what the father is actually going through in this time frame. So I'm very excited and happy to see that, now we are involving the father a lot more, and that we are actually required to, like, it's court ordered. You need to go this day and this time, take this child there, regardless of what the circumstances is. So that's an amazing thing.
Yeah, I love that.
I was gonna build on that. There are some resources in LA County to support expectant fathers or fathers. You have Project Fatherhood, which is part of Children's Institute, has amazing programs
for fathers, whether they're young, old, in the system, not in the system, but it's all about the fathers. Good Plus Foundation does a lot of fatherhood groups. I'm going to get a shout out to Dr. Alan Michael Graves,
Yes.
who really drives a lot of that work. And they also provide concrete resources and supports. Fathers and Families Coalition of America provides resources. Fatherhood groups actually holds a conference. Our expectant fathers can have EPY conferences and get connected to resources. If they're caring for their own child, they can apply for WIC, Women and Children, once the baby is born up to the age of 5. CalSWEC has some training materials. I know under Dr. Alan Michael Graves' leadership, DCFS is finally getting trainings around fatherhood engagement and fatherhood strong. And fatherhood isn't just the father, it's all the paternal relatives who can create a village. How are we reaching out to them as well? My own bias is calling it family time. When the father is spending time with their child, they're not visiting, they're having time with their child. So it's family time. So it's how we approach that as well. And knowing that fathers engage with their children differently and giving them space that maybe they're going to be more physical, but in a healthy way than maybe the mother is. So those are just some things I wanted to throw out in terms of engaging fathers.
I love that, Laurie. And we're unfortunately at time. I'm so sorry. I want to just first thank Barbara Fasher, who's been in our comments with all these good materials and resources. She was actually around during the time I'm talking about when me and my little sister were going through giving birth and that transition. And she played a pivotal role with my sister. And that's how I came to know her, just being a dynamic force in her life. So thank you, Barbara. I'm glad you're here. And thank you to all of you. You have dropped so many gems and a wealth of information as it pertains to how do we show up and support our expecting and parenting youth. So just thank you so much for the knowledge, for your wisdom, and for being here and showing up for us today. And on that note, Happy New Year again, everyone, and enjoy the rest of your day.